Okay, hello everyone. My name is Dorsey Nunn. I'm the Executive Director of Legal Services for Prisons with Children, a proud co-founding member of All of Us Anon, and a proud co-founding member of the formerly incarcerated and convicted people's movement, People and Family Movement. And we're here to talk about COVID-19 and the impact that it's having on our community and some of the needs that we think that we need to actually address. So I would like probably Susan to come up and actually introduce herself.
Good afternoon, everyone. My name is Susan Burton. I'm the founder and president of a New Way of Life reentry project located in Los Angeles County. I'm a proud founding member of All of Us Anon, and I'm also a steering committee member, founding steering committee member of the formerly incarcerated and convicted people's movement. We're an organization that has been providing housing for women who are exiting prison and jails for the last 22 years. We also do organizing and legal services. I want to thank Dorsey for bringing this call together to talk about our approach to COVID-19 for folks who are incarcerated and have been incarcerated. So thank you, Dorsey.
Thank you, Susan. How about you, George? Can you give an introduction?
Absolutely. Good morning, everybody. My name is George Galvis. Thank you all for joining us this morning. I am a founding executive director of Courage Communities United for Restorative Youth Justice. Our mission is to unlock the leadership of young people to dream beyond bars. I'm also a proud co-founder of All of Us or None and proud to serve as a board member of Legal Services for Prisoners with Children and on the National Steering Committee of the formerly incarcerated and convicted peoples and families movement. I would say that a little more than a week ago here in Alameda County, we had one confirmed case of COVID in Santa Rita Jail, and there are now 15 confirmed cases. That means those are just the folks who have been tested. Anybody who knows anything about public health, what all our healthcare professionals and medical professionals have told us is that jails and prisons are like petri dishes. So it's pretty safe to assume that there's a lot more cases that have not yet been confirmed. So to now keep people incarcerated this time is akin to a death sentence. And I guess the question I want people to ask themselves is, what does that say about us as a society if we're unwilling to release folks when lives are at stake? So now more than ever, we're demanding to free them all for public health. 2, end all ICE collaboration. It's not okay to release somebody and then have them snatched up by ICE and put in another cage right away. 3, I think it's important that we need to provide resources, food, clothing, and shelter for all our folks who are coming home. Our responsibility does not end as soon as they're released. That's why we as a movement of formerly incarcerated people are putting up our own resources, putting up our own money where our mouth is, $250,000 nationally to support our folks so that they can have a place to stay safe and healthy while they're sheltering in place. We also need to end all physical reporting. Probation and parole is still requiring a lot of our folks to come in against all public health recommendations and requiring mandatory drug testing. All of that needs to end. Thank you.
Hey, Daryl Atkinson, can you introduce yourself?
Yeah, thank you, Dorsey, and just really honored to be with the other panelists. Daryl Atkinson, he, him pronouns. Organization is co-director of an organization Forward Justice in Durham, North Carolina. Also on the steering committee of the formerly incarcerated convicted people and families movement, and a founder member of North Carolina All of Us Anon. Like many of the other panelists have detailed, we're living in unprecedented times right now in the midst of a global pandemic. And the only mitigating response that we can have that can facilitate the public health of people in the path of this pandemic is socially distancing. Socially distancing is impossible in congregate settings like prisons, jails, nursing homes, long care facilities. And as a result, we are making demands on various levels of government at the local, state, and national level to respond accordingly, and respond accordingly that's consistent with the dictates of public health. Our people are people too, and their health and wellness should be made a priority, just like every other group, where we have governors and decision makers around the state that are closing schools, that are closing public restaurants and gatherings, because they know the only way to stop the spread of this disease is to socially distance, and that is impossible inside carceral settings, in jails and prisons. As a result, we're making a demand that's consistent with the health and wellness mandates that the Centers for Disease Control has put out for the entire country. And we're saying that we are people who should be included within those mandates as well, people who are in prisons and in jails.
All right, this is Dorsey again. And one of the things that I think that we actually want to address is that the whole world has changed probably within the last 90 days. And we weren't able, at least in Northern California and Alameda County in particular, pick up any real services that was provided around the question of housing for people getting out. I think it was last week. We're getting ready to do another release of people getting out. And one of the reasons that's generating this conference call is I think that when we're releasing people, and we're going to applaud the effort to get people out, but once they're released, we got to have a way in which we incorporate them back into our community in a way that makes them safe and make us safe too. So one of the things that Legal Services for Prisoners with Children and all of us are doing in Northern California is that we're going to actually put up resources as a stopgap measure. So over the course of the next 2 weeks, the next 2 days, 2 to 5 days, we're going to rent out at least 50 motel rooms that we're going to put up, and we're going to house people for the next 2 weeks as a stopgap measure, and hoping that the city of Oakland and the county of Alameda can actually come up with a plan about what we're doing with people being released to the community, so their healthcare needs can be met, public safety needs can be met, and we can actually look at this thing in a more rational way. And we recognize that this is not just a local problem. We see this occurring all over the country. We're seeing it occurring in the state of Washington. We're seeing it occurring in Colorado, and we're seeing it occurring in multiple places where we're trying to actually reduce the number of people that we got in jails and prison, but we're not clearly hearing articulated any particular avenue in which people are going to be released in a way that makes sense. And we can't necessarily say that they're going to be released in the best job market ever, because that's not true too. So we got to step up to the plate and actually make a sense of how we handling our family members, our neighbors, and what have you. And all of us in the Legal Services for Prisoners with Children is going to be spending thousands of dollars to house people coming out of Santa Rita to make sure that we address the concerns of our community in a real way. So like, I'd like to probably call on Susan to say what she's engaged in. You're muted, Sue, can't hear you.
This technology stuff. In my introduction, I talked about, we've been doing housing for women who are being released for over 22 years. And I know what it means, not in unprecedented times, to have safety and security walking out of the gates and supports to rebuild a life. But at this time right now, it's critical and it's crucial that we provide and expand our reentry services and just build out a reentry infrastructure. And, I've been talking about this for decades, that all over this nation, we need to be building a reentry infrastructure. I want to say that here in Los Angeles County, Supervisor Mark Riley Thomas created an Office of Diversion and Reentry to begin to start to build out some type of a government response to reentry. It hasn't gotten where I would like to have seen it be right now at this time, but it has started. So I'm working with the Department of Diversion and Reentry and with the Department of Health to actually begin to exit women out of the prisons, and we're focusing on women who are immune system compromised, women who are pregnant, women who are senior, and women who are short to the gate. So I've actually, today I'll be signing a lease on another home that, and expanding our services, you know, to be able to reach more women. So right now we have 25 beds that's available for people, and I'm talking to other providers in the community that I'll be able to refer people and take people to other places, women and both men, because, you know, we have to be inclusive of everybody. But one of the things that I recognize is that we must work with our local government agencies who are ushering these people out, and we're going to have a way to actually place them and engage them. Not unless we stand on, not unless, you know, we're going to stand outside of a jail, but, you know, so I'm working in concert with 2 county departments here to identify the people and send me their names and coordinate the release, that when they walk out the gates, we're there. Another thing that I'm doing is I am working with another agency here to give those people 3 months of stipends along with their housing, because as you stated, we're not walking out into a job, you know, we're not walking out into an economy. So we're working to give people stipends upon their release. Those that have been released in the last 90 days on up until release in June, give them stipends of about $300 or so a month to ensure that they can meet their own personal needs, you know, and not be stretched to compromise themselves. So at our homes, we're all sheltering in place. Everybody had to let their jobs go and think about their health and well-being. And I'm so grateful and happy that we were able to do that for, you know, the 40 residents that we have. But, you know, we want to be able to actually extend that to those that are coming out too. So that's what I'm doing, Dorsey.
Hey, thank you, Sue. Hey, George, how are you pushing? How are you rolling?
Well, we've been leaning in to really demand on our elected officials, the systems leaders, and other core decision makers to make sure our folks are free, that our folks are safe and healthy. We've been placing a lot of demands nationally with all of our other sister organizations, from the formerly incarcerated convicted peoples and families movement, and across, and certainly up to coordinate statewide efforts here in California and locally and regionally. What I would like to say is that jails and prisons have been the foremost way of subordinating communities of color since Jim Crow. Anybody at this point who doesn't know that, I encourage you all to read Michelle Alexander's book, The New Jim Crow, to watch on Netflix The 13th, because this is not a criminal justice issue. This is a human and racial justice issue, right? Our tax dollars right now need to be redirected to serve our communities. So us as formerly incarcerated nonprofit leaders within the FIC PFM network, we are all leveraging our resources, our general support dollars to make sure people have housing, food, clothes, shelter. My folks are delivering food baskets, and we're leaning in to make sure that people have money. We're providing a lot of stipends to all of our members and all of our folks to make sure that they are just able to kind of just get on, just live. And so I say that to say that we're all taxpayers too. So having those tax dollars redirected to serve our communities is of utmost importance right now. I know in Alameda County, our sheriff, and I'd imagine this is a phenomenon that others are observing in their own local and regional jurisdictions, requested $85 million from our Board of Supervisors for COVID response. We don't need to improve conditions inside a petri dish called Santa Rita Jail. What Daryl already spoke to about social distancing is of utmost importance. That cannot happen within the context of a jail or prison or detention center. What we need is $85 million to be allocated and redirected to provide food, clothing, and shelter so that our folks have the right to socially distance and to shelter in place and have a safe and healthy environment like everybody else.
About you, Daryl, before we open it up for questions.
Yeah, I will talk a little bit about, what we've been doing in North Carolina, and maybe I should start with the scope of the problem. We have confirmed positive tests in 6 of our correctional institutions. Our federal facility, Butner, has the largest number of confirmed tests in the federal prison facility amongst all USPs. Someone died there. We've had a confirmed death this morning, and one confirmed attempt to escape because of the lack of response related to the pandemic. So things are escalating in North Carolina quickly. Forward Justice and our coalition partners in the North Carolina Second Chance Alliance have taken a number of different advocacy tactics. We've written the letters, we've done a Twitter storm, we've engaged in pressure tactics, we have a Color of Change petition, and we've also sued the governor and the Department of Public Safety. We sued them last week for immediate, on a writ of mandamus for immediate emergency relief for classes of people that we laid out in our petition. That's at the state level. I think it's important to also understand what FICPFM is doing at a national level. And for folks who don't know, the formerly incarcerated convicted people and families movement is a network of advocacy organizations, over 50 advocacy organizations located in over 25 different states that are led by formerly incarcerated people that are seeking to end mass incarceration and restore the human rights of people in prison and jail. And so FICPFM's response, I would like to maybe describe quickly, in the format of the reporter's questions, what we're doing, why we're doing it, how we're doing it, and when we're doing it. So what we're doing, we're immediately releasing $250,000 of rapid response to go out to our coalition members, mainly via our steering committee members, but also in extraordinary circumstances, our Quest for Democracy network as well, to address the immediate housing needs of people who are being released related to COVID-19. Because this problem is showing up in 2 different ways in states. In some states where policymakers have a certain degree of enlightenment, like in California, where they're letting people go, or as Dorsey refers to it, dumping people on the streets without a coordinated reentry response, which doesn't facilitate the public health mandates of social distancing, because unless you provide that immediate housing response, people aren't going to effectively be able to socially distance and keep themselves healthy. So we're doing that on the immediate level. That's the what. And that immediate response will be in 2 forms. In the form of Dorsey that he laid out in supporting legal services for prisoners with children, and some of our other affiliate California organizations in providing that immediate 14-day housing emergency need so people can quarantine for those 14 days before they find a more long-term solution. But also the what is investing in helping Susan, expand her safe house network in the form of more long-term support for women specifically who are being released related to COVID-19. So that's the what. Why are we doing this? We're doing this because it's consistent with the public health mandates on social distancing that we laid out. We're doing it because it's consistent with demands that we've been making, as Susan said, for over decades around a coordinated reentry response. We haven't just started asking for resources and a policy framework that facilitates the housing, safe housing needs of people who've been released from prison and jail. This COVID response just make those pleas and demands even more urgent, but we've been demanding that stuff for decades. And lastly, it's consistent with our mandates around self-determination and helping to cure the ills within our own, that are within our own control, right? So we are putting our money where our mouth is, as George said, and stepping up to the plate in meeting the needs of our people. But nonprofits and non-governmental organizations cannot be the only response. We're demanding that government at the local, at the state, and at the national level match our response. So whether you're locally talking about your board of supervisors or county commissions, statewide, your state emergency response organization, agencies in meeting this need, as well as FEMA in matching the need at the national level. How are we going to do this? We're going to do this via our network of over 50 organizations that are located all across the country to meet the demand of confirmed positive tests in over 23 different facilities in 23 different states across the country. And then when are we going to do this? We're doing this immediately. We're doing this right now. Those funds will be released, and we're currently accepting requests for proposals from our network partners all across the country to be able to meet this dire need.
Dorsey, if I
For questions. And we got all of us and our members standing in front of Alameda County Jail, passing out the vouchers, as well as having honest and frank conversations with people being released out of jail, because some people need to, we need to inform our people what the conditions are that they're walking into when they come out, when they're being released. And we're doing that also. So let's see, can we open this up for questions to see if anybody got any questions?
There are a couple of questions coming in for the panelists. One is, how can formerly incarcerated people get financial and other needed support? So can you talk about direct lines for people who are looking for support right now?
In relationship to what we have done so far, probably everybody on this phone call, when the virus, when they first started releasing people, automatically set up an emergency fund where we gave out thousands of dollars of $100 gift cards before we get to this press conference. At least I know that I've done it. I know that Susan done it. I know that other formerly incarcerated people around the United States start dipping in their unrestricted funds and sharing the resources that they had available to share. We will continue probably reaching out and actually pursuing other gift card opportunities in addition to the meeting the housing needs, so people can actually feed themselves if they are caught up, because as you know, many of us are low wage earners, and we're not going to be able to get access to the resources that we actually need. So some of us need the help, and we are trying to make that as available as possible, while pushing as hard as we can to get governmental entities and other entities to step up in a more responsible fashion.
I would just add
for a new way of life, for people in the Southern California, Los Angeles County area, we responded initially with pushing out relief to 600 people in the form of gift cards. And now we've transferred to make a more intentional effort to catch people as they are walking out of the jails. But what I want to say is that people can email a new way of life that are in the Los Angeles County area. I'm sure you can email Dorsey, who is in the Alameda County area. But we like Daryl mentioned, we have a network of 50 organizations, and each organization is responding to the immediate needs in their areas while advocating at the a state and federal level also. So you can go to anewwayoflife.org and send a request on info, or you can call our offices at area code 323-563-3575, and we will respond as soon as we can and with some sort of support, help, or information for you.
I just wanted to add that each of us is leaning in. I think among our 50 members within FICPFM, I would encourage folks, to reach out to any of our affiliate networks. As Susan and Dorsey both mentioned, A New Way of Life in Los Angeles, Southern California, Legal Services for Prisoners with Children, and Communities United for Restorative Youth Justice in the Bay Area. But we also, as Daryl mentioned, have affiliates in 25 of the 50 states. So I think if folks can reach out directly through us, through our website at FICPFM, that would be one resource. But what I really want to emphasize is that the resources that we're providing are just a drop in the bucket. I mean, for us, that's a lot of money. And we know how painful it is to come home, but under these circumstances, this is really unprecedented in our lifetime with this pandemic. And so we're all leaning in, we're all scratching, to make sure that we can provide much needed resources, opportunities, and services to our folks. But the $250K we're providing is just a drop in the bucket. So I really want to invite folks to join us in really demanding that our tax dollars are reappropriated and redirected in ways that serve our communities.
One of the things that I think that I need to mention is people can visit, go to www.prisonerswithchildren.org, because we immediately upon the beginning of this pandemic, we started creating manuals that we start sending into to prison, telling people how to ask for the immediate release if they are in a part of that vulnerable population, and how do they actually stay healthy while they're in prison. Right now, we're trying to make sure that people coming home from prison also able to stay healthy. Because like I said, somebody needs to tell people that they're walking into dangerous times. And they just can't be hanging out with each other right now. So that's one of the reasons that we got people standing in front of that area. And we will continue to do everything that we can to actually provide additional services to their people. And we're asking people in the philanthropic community to step up in a much more greater way, because we got a crisis that is going to be growing if we don't address this problem. Daryl, do you got something to add?
No, I put in there, I think you all have covered it as far as, how people can reach out related to their immediate needs with regards to direct responses. I also put in the chat that they can email FICPFM National Organizer Mike Biggs at Mike, M-I-K-E, at FICPFM.org in the event that your request is outside of the jurisdictional area of California, either Northern or Southern California. Mike can direct those requests from other parts of the country to the appropriate steering committee or Quest for Democracy network org on the ground.
You got another question?
Yes, so the next question is about the other end of people who want to be involved, which is how, if you're an individual and you want to help in supporting people who are being released, how can you get involved?
I would encourage folks to visit all of our websites, www.curyj.org, Legal Service, Prison with Children, New Way of Life, Forward Justice, FICPFM. I think by linking up to our websites, we can direct folks to the appropriate staff person to just kind of help coordinate and engage folks. What I will say is this Thursday, we are planning a car rally at the Alameda County building, and we're going to be doing a caravan from there to Santa Rita Jail. So we want to ask folks who are in the Bay Area to please join us to honk for justice. We know some of our affiliates are also engaged in demanding the closure of 850 Bryant Street, in the facility in San Francisco, and are going to be having actions, I believe their press conferences tomorrow, and Wednesday they're having a a thunderclap asking folks to join in social media to kind of take action in some of the digital activism opportunities. So I think that there's lots of ways for folks to get involved. A lot of it is digital activism, but some of us are also coordinating some of these car rallies. And so invite folks just to reach out, hit us up on our websites. Thanks.
And we should have something posted on our website because I believe it's at 12 noon on Wednesday. We're going to have members of All of Us and None because we are a chapter-driven organization, and we got something like 25 chapters all across the country. And what we're going to do on Wednesday is we're going to have chapter leaders out of New York, New Jersey, and in Chicago talk about how this COVID-19 is impacting them, their families, and the incarcerated people in those areas. So that'll be at 12 o'clock on Wednesday, and you should be able to get that information further by visiting our website.
Okay, got one more for you guys. So what's going on with the larger movement? You know, we talked about some of the systemic things, things like discrimination, will be getting jobs and housing and among property management companies. Can you talk about the work that's being done to for the larger systemic issues versus what's being done with the immediate crisis?
Do anybody want to pick this one up first?
So let me just say, Dorsey, that nationally, FICPFM, the formerly incarcerated and convicted movements, have been working on the restoration of the civil and human rights of people, but also looking at how investments, there's a disinvestment in communities, and working to pass laws, pass bills, and to transfer money from corrections and incarceration back into the community. And I think this moment, this unprecedented moment, speaks to how we overinvested in prisons and jails and underinvested in hospitals and health. And so coming out of this, we will continue to push, we can continue to work, but all across this world, but especially in this nation, we can look at the effects of overinvesting in jails and incarceration, in law enforcement, and disinvesting in hospital, in healthcare, in things that make our communities safe and well. I mean, we can't even begin to address the individuals who are in need of health care right now. I have ambulances pulling into my community, and they're walking away, leaving people to die in the night because there's nowhere to take them. But we also have police pulling into our communities, and they have a place to take people. Something's wrong with that. Something's really, really wrong with that. So coming out of this, I mean, we have been working for a real understanding of what health and safety means across our communities, across this nation. But right now, I think that there's a spotlight, a real understanding of what we've been advocating for and what we've been talking about. And I'm sorry that it's COVID-19 that wakes up and shakes up and to say, this is what we've done and this is why we're in the shape that we're in right now.
Yeah, I think just to kind of build on Susan's comment, I think the question kind of maybe lays out what could be seen as a false dichotomy. Either we have to be doing COVID rapid response or working on more long-term systemic change solutions. I think the COVID rapid response, in my estimation, has revealed the need for the more long-term systemic solutions that many of us have been advocating for, like we said previously, for decades. To Susan's point, we didn't just start advocating for people, not prisons, for books, not bars. We've been advocating for a reinvestment. Yeah, we've been advocating for a reinvestment of taking money out of the carceral state and putting it in other forms of community support that address the socioeconomic indicators of health and wellness. We've been advocating for that for decades, right? That didn't just start. COVID-19 has revealed the most pressing needs for things like transitional housing, for things like fair employment and banning the box and not using criminal record history as an automatic discriminator, because we know 16 million people have filed for unemployment in the past 2 weeks, that people with records are going to be sent to the back of that line. We already know that. And we've already been advocating for those kind of more systemic changes for decades. And I wouldn't pit COVID rapid response against those other more long-term systemic needs, because they can be coupled together. The pandemic just expresses the more urgent need for those pleas to be met in a more timely fashion.
Hey, this is Dorsey. One of the things that I think that, legal services for prisoners with children got a history of 42 years. And all of us none is probably about 17 or 18 years. Susan spoke to the issue of doing this work for 22 years. So one of the things that probably didn't happen over the course of time is that we didn't invest it in infrastructure, because that we know that we're in a sustained struggle, and it's going to be a protracted struggle. It's going to be more than just this virus. We got to change the very composition of how people feel about people, because we're coming home one way or the other. And if we come home and we don't develop reasonable plans for us to be incorporated back into the community, then it creates havoc. It creates bad health practices. So, I need to say that I love people inside of jails and outside of jails. And I want everybody to have some degree of health and safety. And I think that it's incumbent upon us to build that. So everybody that you're hearing in this press conference is not just committed to the nonprofit part. They committed to the cause of justice in a real fundamental way. And it's probably been there for a long time. And some of the things that we've been demanding have been being demanded for a long period of time. And I'm like Sue, I'm sorry that it was COVID-19 that points out the inequities in healthcare. And we already know that there's a whole bunch of Black and brown people locked in cages, whether it's jails, prisons, or detention centers. We already know who's there, and we already know that when you look at that list of who's dying from this virus, you can see the inequity in terms of the death, as a result of actually not necessarily paying enough attention in the healthcare field to actually care for people of color and people who are poor. So we're really fighting those things on all fronts. So it's not like, I'm in danger just because I've been to prison. I'm in danger because I'm a Black person too.
Racism has really reared its ugly head in this time, and it's a life and death situation. Like I said, I see, ambulances and talk to people who, Black people, who are not getting taken to the hospital. Again, there's been a whole disinvestment in our healthcare infrastructure, and an overinvestment in the carceral state. And this is where we are. But once again, I just want to say racism has reared its ugly head. And as a result, Black people are dying disproportionately from COVID-19.
Yeah.
I'd like to just add that what's become abundantly clear is how much disaster capitalism is at play right now in the age of COVID. We are seeing people opportunistically basically treat this disaster as an opportunity to exploit and more money grabbing and more power that just kind of perpetuates this sort of autocracy and plutocracy that that we've been evolving into here in the U.S. I think my traditional elders have always taught me all my relations, this indigenous concept of being interconnected and interdependent. And so, more than ever right now, I think it's very clear that all these issues, housing justice, food justice, health justice, economic justice, environmental justice are all inextricably linked. And because when we are trying to get our folks liberated from, these jails and prisons that, as I said earlier, are essentially petri dishes for this virus, we also have to be mindful about what we're releasing them to. And we want them to have housing. We want them to have food. We want them to have access to healthcare. We want them to come into an environment that's safe and healthy. And economics is important too. So, because otherwise people can't continue to sustain themselves. And we've seen the widest gap between rich and poor since the Great Depression, and that's essentially where we're headed again. So history tends to repeat itself. I think it's important to think comparatively in a social historical context. But what I think folks should take away from this more than anything is that scientists and many others were heeding the call that this kind of pandemic was on the verge, and many of us ignored them. Similarly, many of us have been crying and talking about how prisons and jails and prisons are not the answer, and that those are gonna just, destabilize our families and communities. And so what I would say is really pay heed to the content experts. And in the case of so-called criminal justice, it's those who are closest to the pain that are close to the solution. We are the experts of our own lives. So formerly incarcerated people should now more than ever be heard and listened to, because unfortunately, oftentimes y'all don't see us unless you feel us. You know what I'm saying? So I would say that that's true for each and every one of those movements. And once again, in the words of Assata Shakur, more than ever, we got to love each other and support each other. Thank you.
Hey, before I take the next question, I just need to point out the other thing that's happening during this particular pandemic is formerly incarcerated people are becoming more technological savvy. So you're hearing us show up and we're doing organizing in different ways. So it's not just building the infrastructure, we're actually building the platform for us to do better organizing. And so I can say everybody in my shop and a lot of other shops are actually paying attention to how to use Zoom, how to use Hustle, how to do fencing, how to do a number of different things that it may have been just abstract notions before. Now it's going to become a regular practice. Do we have another question, Paula?
Yeah, just before you go to that question, Dorsey, I just want to build on what George was saying and say that, we are closest to the solution. We do have solutions and approaches that are just can't, come out of a book and can't lead people the way we lead people and the way we build leadership. And I think now is the time for a deeper investment in our leadership, in our role of bringing people back into the community. I think now is the time for government, for philanthropy, for individuals to support what we're doing, because the other part is that we get real results. We get real results, and we need resources to get those results. But I just want to encourage an investment in what we're doing here as we prepare to usher people back into the communities in a way that is safe and healthy and promotes a future for our folks, for our communities. So I just wanted to piggyback on what George said. So we can go to the question you asked for.
I think that we're going to be leaving this conference call, leaving this press conference real soon, and we've been on for a while. And, and I definitely got to thank the All of Us Anon membership that's standing out in front of that jail, because if they say that it's a first responder, I think it's some of those people standing in front of that jail. And we had to go out and beg and hustle to get them face masks in order to be able to do that. People that's going to be leaving the jail today in Alameda County as a result of the participation of BOSS is going to be given face masks and hand sanitary stuff so they can come home and have just a reasonable chance of surviving this pandemic. People are going to be given ultimately track phones so they can actually do social isolation, because what makes it easier for me to do it is I got computers in my house, I got phones in my house, I can call somebody. And sometimes after you've been in jail and in prison, you're only touched suspiciously and violently, and you want to be touched in other ways. So, you know, we're gonna have to actually ask them to buckle down and to stay safe and explain the necessity of staying safe. So if there's no further questions, I would like to thank everybody who participated in this this press conference, and I hope that we said something that inspired other people to actually take up this cause in a real particular way. And I like to thank, you know, and I'm on the steering committee too of the formerly incarcerated and convicted people's movement. And I'd like to thank all of my comrades and colleagues that allowed me to have a significant amount of money, because Legal Services for Prisoners with Children and All of Us Are None only had $25,000 to put into rapid response for housing. All the rest of y'all chipped in and gave me another 25 to put in. And other people sent me other money. And I can absolutely say from all the people that I know that's down for the cause, we actually laid money and resources back immediately to help house, feed, and clothe our people. And we think that everybody else that's engaged and say they care about people should actually do the same thing. So I'd like to thank you for joining the call. Anybody got any closing remarks that they want to make?
Yeah, I just want to invite everybody.
Yeah, I would if I could. I've been waiting to get in for a moment.
Yes.
I do think, you know, I would be remiss if I didn't say that for many of us, this is an I told you so moment, you know, and this may not be the proper time to articulate those sentiments, but I think we have to. We have told people for generations, for decades, that prison should not be the social service of first response for our people, for people who are vulnerable. We've told people for decades that, and that's an I told you so moment. Also, I want to point out in this whole movement around decarceration, there's a certain vein of folks who have been enamored, rightfully so, with getting folks out of cages. Everyone on this call has been in a cage, and we know how debilitating that is. But equally debilitating is getting out of a cage and not having the ability to live. And we have, I told you so, to philanthropy, to government, to even so-called allies in our decarceration movement, that you just can't be enamored with getting people out of cages. That folks, once they get out of cages, they have to have a viable way to live. And now this COVID-19 pandemic has revealed in many states the lack of governmental policymaking and resources devoted to direct service needs, the lack of philanthropy funding direct service needs as far as reentry and funding reentry policy change has presented an I told you so moment that now we're scrambling to put these kind of supports in place when we could have done that decades ago, years ago, and we would be so much more prepared for this. So I just think it's an important moment for our movement to reckon with, that it's not an either or proposition. Either we keep people out of cages or we support them on the back end. It's a both and proposition. And we have told you so, that this is something that our community needed for decades. And now is the time to step up.
The other thing I just want to say is, as we invite folks to join us in this effort, it's more important than ever that we not subscribe to this false dichotomy of the deserving and undeserving, because I've seen a lot of the calls to say, let's release all so-called quote unquote nonviolent. I'm gonna just say, when I was incarcerated and charged with multiple felonies at the age of 17, those were all violent felonies. I would have been one of those folks that would have been held behind enemy lines, and that's probably true for most of my comrades. I'm also a California Peace Prize winner, and I know I've touched thousands and thousands of lives, and in turn, those folks have touched lives. So I really want to just reinforce this concept of violent versus nonviolent. What we're saying is free them all for public health right now. And I want to encourage folks right now, it's real easy just to pick up the phone, to tweet, to post on social media, repost on Instagram, join us in some of these thunderclaps to demand actions from our decision makers. Some of y'all who are able to join us at some of the car rallies, like I mentioned before, we'll be convening at noon at the Alameda County building on Oak Street in Oakland, this Thursday. And there's going to be actions happening around the country. Please follow each of our websites and the FICPFM website to help coordinate and join these efforts. Thank you. It's a takeover, not a makeover, y'all. They might be trying to do some things right now around this disaster capitalism, but this is our opportunity to lean into, because we know, like I said before, that those closest to the pain are closest to the solution. Peace.
So I just got a call from the ICE detention center. They're going to release one. Hey. Yeah, that's what I'm talking about.
All right. So once again, I'd like to say thank you. And on Wednesday, all of us Anon will be having another conference convening where we're going to have 3 people talking about what COVID is doing in New York, New Jersey, and Chicago. So I'd like to leave this call with saying thank y'all for showing up. Thank y'all for joining me, especially my comrades that took day out of their time to actually get on this call. And thank you for listening, for everybody that's out there that I can't see and that are listening to this call. So thank you for
Thanks
joining
so much.
us. All right.
Bye, everyone.